night. My name is Kaylee. I'll be your student nurse today. May I have your name and date of birth, please? Charlene Knight, 8839, allergic to latex, penicillin, and betadine. Okay, that's what I have on my orders. So I have heard that you are having some trouble urinating. You haven't urinated in the last 10 hours. The doctor has ordered a Foley catheter for you, so I'm just going to assess this area to make sure that that's appropriate, okay? All right, so let me get your bed up. I'm going to do my hand hygiene. Don some gloves. All right, let's assess that area. Pull this up for you, Miss Knight. All right, so I'm going to palpate your bladder. Let's see, I see it's a little distended. Are you feeling any discomfort? Yes? Okay. All right, let's see down here. I'm identifying the meatus. I don't see any redness, lesions, discharge, anything like that. I know she just had perineal care, so that's not needed at this time. Okay, so it is appropriate to put in the Foley catheter, okay? So I'll just actually leave that. So I'm going to throw this away. Okay, so Miss Knight, I'm actually going to put on some more gloves to make sure that I can get your legs into position, okay? Sorry about that. Okay, let's get your legs into position. So I'm going to have you like this, okay? All right, there we go. Okay, now I'm going to perform hand hygiene because I'm about to perform my sterile procedure. All right, so I'm verifying that this is a 14 French catheter. It expires in 2017, so we're good. And there are no allergens that would cause her a reaction. No latex, penicillin, or betadine. Okay, I have a flat, dry surface. The Foley is not opened or anything like that. Okay, so I'm going to go ahead and that does match the physician's order. I'm going to make my trash bag. Put it at the end of the bed right there. This can go in trash. Alright, so I'm going to turn this. Okay, so we're starting with away from me. Only holding those 1-inch margins to the left, to the right, and towards me. All right, now I have my blue drape on top. I'm going to pinch the blue drape, step back, only holding those 1-inch margins, opening it so that the shiny side is towards me. I'm going to come over to my patient. And dropping it around. Now I'm going to come around here, not crossing my sterile field, pull it closer to her a little bit. Okay? Okay, now I'm going to turn my sterile field so I have a little more room. Okay, it's gloving time. I'm going to take my gloves, pinching the center, and drop. going to open alright. Make sure that that's nice and folded. Fingers under and open. I'm going to take my non-dominant hand, pinch the cuff, step back, supinate. These are tricky. Taking this hand, going under the cuff, stepping back, I'm now sterile. Okay, I'm going to take my white drape, step back. I can touch all of this because I'm sterile. I'm going to lay this over the patient. Okay, now I'm going to get my box ready. I'm going to turn this so I have some room. Okay, so first I'm going to lube my catheter. I'm going to take the sheath off the catheter, making sure not to lose control of the catheter, and trash. I'm going to take my lubricant, trash. Pour some lubricant there, trash. Lube it up in the corner here. Okay, that's good to go. Now I'm going to take my hydrogen peroxide, trash, and wet all my cotton balls. Okay. Trash. Okay. Now I'm going to take my syringe. The manufacturer does not say to inflate the balloon, so I'm not going to do that by exercising the plunger and whatnot. So I'm going to say that this is a 14 French catheter. It can hold 5 to 10 milliliters of, this is sterile water. So I'm going to remove the cap. Trash. Take this and insert it here. Alrighty, and leave that there when we're ready. Okay, so I'm going to take this, putting this over here, and my now sterile kit. Come over here, and alright, so now I'm going to take my left hand, this is going to become my dirty hand, and I'm going to open up the labia. So I'm cleaning right now. I'm taking my forceps. Okay. For our outer labia, around trash. We're going clitoris to anus. Inner outer labia, around trash. Middle, around trash. One more time. Outer, around, trash. Inner, around, trash. Middle, around, trash. Forceps in the trash. I don't need this anymore. I'm going to put that in the trash as well. Okay, now I'm ready to insert my catheter. So I have my lubricated end. I'm holding it 2 to 4 inches from the tip. Okay, Mrs. Knight, I'm going to insert your catheter. You're going to feel a little pressure, so bear down for me, okay? So I'm inserting my catheter into the meatus. And I'm going to wait to see urine. I'm not touching the labia at all because I am sterile. Okay, I see urine now, so I'm going to inch it 1 more inch. I'm I'm going to stabilize it with my non-dominant hand. Inject all 10 milliliters to inflate the balloon. Okay. Now I'm going to bring this over. Trash. Now my sterile procedure is done. I'm going to take a little tug. It's in there. Did you feel any discomfort? Are you feeling any discomfort now? No? Okay, so I know it's in the bladder. It's not in the urethra. She would feel pain if it was in the urethra. Okay, so at this point my sterile procedure is over. I would take the bifurcation and attach it to her inner thigh. I would then hang the bag below the bed here on a hook, but not on the side rail. There's a specified hook for that. I will actually go ahead and do that now. And I will assess the I and O's. I will make sure there's catheter care done every shift, as well as perineal care. I'll go ahead and document the procedure. Mrs. Knight, you feeling all right? Great. Awesome.